So this is the Beat Bladder Cancer webinar. Welcome everyone. I'm going to hand you over to the president and founder of Beat Bladder Cancer Australia, Adam Lynch. Over to you, Adam.
Thanks very much, Kalli, and good evening, and thank you everyone for joining us. Could I firstly, just on behalf of the whole Beat team at Beat Bladder Cancer Australia, give a big warm welcome to everyone who's joined us today for this Health and Wellbeing Living with Bladder Cancer webinar. It's a wonderful attendance. It's great to see so many of our inspirational nurses and lots of our incredible patients and carers. And we're privileged to have such a brilliant guest panel that you can see on the screen here, all leading experts in their fields of health and well-being. So thank you for agreeing to be panelists and being with us tonight. Thank you. Now, we hear a lot about health and well-being, but what does it actually mean? What are the truths and the myths? And how can it help each and every one of us? So to patients and family, we hope that you find lots of really valuable information to help and support you through your bladder cancer journey. And for the nurses, we would love this session to help best inform you in your conversations and advice with your patients and their families. So I'm really looking forward to an incredibly engaging discussion. And on that note, I'm going to hand it back to Kalli and we're going to really get into it. So enjoy the evening, everyone. Thank you.
Thank you, Adam. You are in the right place. If you've just joined us, it's the Beat Bladder Cancer Australia webinar. It's a Q&A session, and it's your chance to really ask as many questions as you want. And that can be done in the Q&A box at the bottom. If you'd like to remain anonymous, you can. So I would like to now introduce our esteemed guests. Firstly, I'd like to introduce my co-host, Christine, who's put in a lot of hard work for this session to be a success. She spent a lot of hours gathering all your information and get you registered to join in. So there's a lot of work that goes on behind the scenes to make this happen. Thank you, Christine. We do appreciate everything you do. So I will start with Alana and Celeste, and they're from the Westmead Hospital in Sydney, from the Dietitian department, and they're under the supervision and guidance of Peter Talbot. Alana Brittain has a particular interest in medical oncology and radiation oncology, and Celeste Lai has an interest in radiation oncology, and they're based out at Westmead. We also have Associate Professor Judith Lacey, and she's from the Chris O'Brien Lifehouse Centre, Wellness Centre, also in Sydney. She has a background in palliative care as well as general practice. But now her main focus is on integrative medicine, and we're going to hear all about that and exactly what it is. Our next speaker, so thank you for joining us. Our next speaker is going to be Penny Smith, and she's joining us all the way from Melbourne at the Olivia Newton-John Centre, which is also a wellness and research centre, and she's had many years of experience running the facility, and she also has a background in occupational therapy. So thank you for joining us. And then last but not least is Dr. Andrew Hirschhorn, who's from Macquarie University Hospital in Sydney, and he runs the physiotherapy department there and has a PhD in physiotherapy. So we're all in very good hands tonight with very highly regarded colleagues in their fields, and we're going to pick their brains. So once again, I'm going to encourage you, and you can start from now, starting to ask questions in the Q&A box. Anything you want to know about any of those topics, from physiotherapy to OT to wellness and health, survivorship, to integrative and complementary medicine, and nutrition and dietetics. So what I think I'll do just to get us started off, because this, even for me, my background is urology, urology surgery, so very medical. And, you know, certainly in our training, we get told about, I mean, it's a new thing that, you know, there's not only the biomedical model, there's also, and there's a few other elements. We're dealing with people, and they also have psychological issues, or they may have social issues. So there's a lot more to just the medical. And I think that's what integrative medicine is all about, isn't it, Judith? And I hope you'll be able to tell us a little bit about what this new and emerging field is all about.
Yeah, hi. So I'm from Chris O'Brien Lifehouse, which is actually a comprehensive cancer centre, and I run the Integrative Oncology and Supportive Care program. So it's really about integrative oncology is this whole, quite a new field. Integrative medicine isn't, and it's the use of, it's actually there's a definition that was published in 2017 that to try and define it a little bit better. So it's patient-centered care in using mind-body therapy, natural products and lifestyle changes to keep people living well with cancer alongside of regular Western medicine. So it's to complement the treatments, to improve quality of life, well-being, empower people, and assist people from the time of diagnosis through to survivorship and living with cancer, and using evidence-informed and evidence-based complementary therapies.
Okay. I mean, something that, you know, especially coming from the medical side, and we're all about science and evidence, and a lot of questions we received was, you know, is there evidence to support complementary therapies? Is it safe? Can we trust it?
So the definition of complementary therapies, I think, is not all about herbs and supplements. And I think that's quite a, the media sort of supports, well, it's all about taking all those pills that you see in Chemist Warehouse and supplements and herbs. Complementary therapies that are used in integrative oncology and integrative medicine are evidence-informed or evidence-based, which means we've got a reasonable level of evidence from that these are firstly safe and that can improve outcomes for patients. So when we're talking about complementary therapies, we're talking a lot about the mind-body therapies like yoga, mindfulness, qigong. We talk about touch therapies, oncology massage, which is massage practiced by people skilled in understanding what goes on for cancer patients, reflexology, acupuncture, which has been around for centuries, and then different changes to diet that are safe and can potentially improve well-being and perhaps reduce cancer recurrence and improve sense of well-being during cancer treatment and beyond, as well as, of course, exercise. So exercise physiologists, interestingly, if you look at funding from private health insurers, is actually sits in the complementary medicine box, which is interesting. But exercise is medicine. It's a part of medicine from the time of diagnosis all the way through. And so all of these work together to complement other treatments. It's evidence-based, evidence-informed. And you know, a lot of money's gone into pharmaceutical industry and funding for research in big surgeries and big pharma, but there is growing support of research in this field. So the evidence is growing rapidly. And so it's exciting, and it is safe and keeps people well.
Yeah, I mean, you do also hear about all these sort of wonder cures, sort of some vitamins or herbs that can actually cure cancer. I mean, what is your feeling about that? I mean, how do we guide our patients, or, you know, I mean, if it could surely cure cancer, you know, we'd all be out of work. So how would you speak to that?
So that's a common reason that people come and see me. They say, well, can, medicinal cannabis is the classic example of a herb that's been thrown around. Does this cure my cancer? The answer is it may have some anti-cancer benefit. And that's why a lot of us are doing research in that space to see, does it? And it's a very complex herb. Similarly, some of the Chinese mushrooms like turkey tail that's being studied in hepatocellular cancer, maybe that has some role, but it's not alternative medicine. It's as well as, and there's definitely for some herbs and supplements, there may be benefit in improving energy, improving sense of well-being, improving the bowels, improving response to other treatments, supplementing deficiencies. As an anti-cancer treatment, we don't know. And so there are studies and there's research. So it's not alternative medicine. And I don't think with cancer treatments as good as they are today that there's any justification for alternate medicine unless it's of a standard that is being studied well to be as effective as the other treatment. And those studies have not been done yet.
Oh, interesting. Now, you did touch on something that comes up on all the forums and definitely comes up in our support group, and we all would love to know more about. But before we get to that, our audience is incredibly quiet this evening. I don't know, I'm going to have to coax everyone in their homes. I don't know how I can do that. Please don't be silent. Send some messages in the Q&A box. Anything you've ever wanted to ask about herbs or vitamins and medical cannabis, which we'll hear more about now, but I'm sure there's some burning questions. Mind the pun. And can you tell us what is the difference between CBD and THC? Firstly, what are they, and then what is the difference?
Well, let's talk about what cannabis is. And cannabis is a group of plants. So there are about 700 different varieties of cannabis. Each of those have about 144 different cannabinoids that we know of at the moment. Two of those cannabinoids are CBD and THC. And then there's also the terpenes and the flavonoids and all other components of cannabis as well. So when we talk about cannabis, we commonly talk about THC and CBD, which are the two major cannabinoids. So CBD you'll hear about a lot because everyone in America is using it. It's great for your skin, it's great for your immune system. What it's really good for is epilepsy in children. And it may also have a good anti-inflammatory, anti-anxiety, and potential immune modulating effect. It's not psychoactive. And the second big cannabinoid is THC. And THC is the psychoactive component of cannabis that is commonly in very high in recreational cannabis. It's the bit that makes you feel high, but it's also the component of cannabis that helps with appetite, gives people the munchies, and particularly in cancer, that's really important. Helps with nausea, helps with pain, but it's the dose, but that limits the dose titration because you don't want your patients to feel stoned. And we often will hear about the combination of CBD with THC because they modulate each other. The CBD modulates the THC. So a lot of our prescribing is usually in a whole plant product, which has become increasingly popular. So that's, sorry, that's my dog. It's the, because there's something that we call the entourage effect, where all the different components of cannabis somehow work together to enhance its benefit. And its anti-inflammatory action, different cannabis, different combinations of cannabis and different combinations of the cannabinoids can be more, and the terpenes can be more sedating, more anti-inflammatory, more arousing, make you less paranoid, make you more paranoid. And so it's trying to get it all right for that person to have the best outcome. So that's cannabis in a minute, 2 minutes.
Okay, now of course we want to know, how do we get this? How do we get hold of this? Do we just grow it in our backyard, or do we need a prescription? Do all doctors prescribe it?
So the answer is, if you live in Canberra, you can grow it in your backyard. I don't know where you can get the seeds from. And if you live in any other part of Australia as well as Canberra, any doctor can prescribe it, and some nurse practitioners can as well. And it's through the TGA, through the Special Access Scheme, and it's a very simple process if you have the right indication and your doctor takes the time to make sure that they're prescribing it for the right indication for the right person in the right way. And so, you know, I'm not an authorised prescriber, except for on the government study that I'm on, but otherwise I prescribe like any GP can prescribe, or any specialist, a urologist, for example, can prescribe cannabis. It's taking the time to make sure that you understand that, say for refractory pain, how do you define refractory pain? What does it mean to not respond to any other treatment that you've tried to the point where you just need to try cannabis? And how do you explain that in your application? Similarly, for difficult to control nausea during chemotherapy, difficult to control anorexia, loss of appetite related to cancer, and so on. And so it's very available right throughout Australia. I'm not sure about Tasmania, but yeah.
So GPs could prescribe
Definitely.
could prescribe it, and it's their personal choice, or do you have to have a training course to be able to do it, or how would you know what to prescribe?
So I think so we're running a lot of training programs. There are quite a few of us involved, giving our time to be involved in running training programs. There's also cannabis access clinics popping up that can help GPs to prescribe as well. But you need to learn the basics in order to prescribe. But it's learnable and it's doable, and there's a lot of help out there.
Someone asked, is it available on the PBS?
No.
No.
Oh yes, for multiple sclerosis and epilepsy in Dravet syndrome, yes, but not for cancer.
Not for cancer. And what about cannabis and driving laws, if it is prescribed for you?
Well, if you have any cannabis that has THC in it, you can't drive at the moment. And that's the law. The law is being reviewed because it's a lipophilic. It binds to lipids. It binds to and it hangs around in your system for days after you've taken it. And so even though you don't have any effect from it, it can still be picked up. So the tongue scrapings they do will pick up cannabis in your system. It's obviously not a great law. And so there are people very actively trying to develop a system where they look at people affected by the impact, the psychoactive impact of cannabis. It will change over the next few, hopefully months, not years, but we'll see.
Someone else asked, Meg Hughes is one of the cancer nurses, is it first-line treatment, or do you need to have tried something else first?
Oh, it's definitely not first-line treatment. It's a special access scheme, which means that you need to try everything else. So it's for refractory symptoms that whatever you've tried, people are really suffering and not responding well to any of the treatments that have been prescribed, or they're not tolerant to them, and working out how to improve quality of life for people. So,
and where would you actually physically buy it? Is it available at a pharmacy, or is it and how do you know the dose?
Wow, I didn't know I was going to be talking about cannabis.
I know, and we do need to speak to the other people as well, but we'll just...
The very quick answer to that is, for example, if I prescribe it, I have it it comes to my pharmacy at Chris O'Brien Lifehouse, or I can organise it to go to another pharmacy. The companies are excellent in developing that relationship with pharmacies, and there are a lot of pharmacies that are now able to, it's an S8, it's like endone or morphine. it's in a locked cupboard, stored in a particular way, and if the pharmacy have the storage facilities and are open to distributing, then it's available. And the dose is self-titration, starting at the lowest effective dose and gradually increasing. We don't want people to be stoned. You want people to have the benefit from their symptom, improved symptom management and good quality of life. And it comes back to what integrative oncology and complementary medicine is all about. It's really about improving the quality of life for people living with cancer from the time of diagnosis. So if you think of that with cannabis, you don't want a whole lot of people being stoned. You want them to feel hungry, less nausea, less pain, improved sleep. So it treats those clusters of symptoms, and the lowest dose that for them works to improve those symptoms. And so we're doing a lot of research around Australia with our governments to really make sure that we're getting it right and learning more along the way.
Do you have any preliminary information or statistics of how it's been used in Australia? Has there been?
Yeah, so there are actually a lot of statistics, and there are I think it's about 3,000 scripts a month at the moment, but I'm not sure. There's a guy called Rhys Cohen who's mapping this all the time, and if you follow him, you'll see the maps. But the TGA actually will publish those regularly. And we know that there's been a lot of benefit, reduced opioid use in chronic pain. The big thing with cancer is people are living longer with cancer, and you don't want people to be addicted to opioids as well. So if you're finding the right drug, hopefully we'll find drugs that are less addictive that can improve symptoms for patients as well. And that's why there's such big interest in cannabis around the world.
Yeah, and the last question related to cannabis, and then we'll move on. Are there any side effects that one needs to be aware of when using it?
Yeah, well, people can get stoned. So they'll feel a bit out of it. They may get paranoid. There's a risk of people becoming depressed or anxious. Some people may get upset bowels from it. It's an oil-based product, and you may feel dizzy. So there's a list of side effects. And also you have to realize that CBD particularly is metabolized through through the liver, through something called the cytochrome P450 system. So it can interact with other drugs, particularly in high doses, and make those, particularly the anti-epileptics or the benzodiazepines, hang around for longer and more potent. So it's or warfarin as well, for example. So you need to be very careful.
Thank you very much, Judith. We will come back to you later. But let's talk to some of the others. We've had a few questions coming in for the dietitians. Alana and Celeste, that's you. So just sort of I guess an introductory session, sort of, are there any recommendations you have to patients who might be who are going for surgery? Let's say let's address each possible management option in bladder cancer. Patients going for surgery, are there any dietary recommendations? Patients who are having chemotherapy, and patients who might be going for radiation.
So I guess before surgery, we often tell our patients to optimize their nutrition the best that it can be. So how we kind of assess that is making sure that the patients are, I guess, relatively weight stable. So if they're weight stable, they're eating a variety of foods, then that's considered that their nutrition status is relatively up there. If patients have had any experience with like unintentional weight loss, and we need to optimize their nutrition that way, just to help with like wound healing that comes with post-surgery, then we can recommend something like a high energy, high protein diet. So this is kind of like a diet that's done in a short-term way. So patients are not expected to follow a high energy, high protein diet once they've had their surgery, gone through their treatment, and have recovered. It's more so to I guess optimize one's like calorie and protein intake so that their weight stays stable before surgery. So recommending that patients have small frequent meals, especially if if they do have episodes of, for example, poor appetite, making sure that they're having like high energy, high calorie foods. So your high protein foods are things like your meat and meat products, so things like beef, chicken, fish, eggs, any of your dairy foods and dairy products as well, but also things like nuts and seeds and your soy and soy products. And then in terms of with your high energy foods, they're mainly things like your fats and oils. Okay, so things like olive oil, canola oil, peanut butter even, or your kind of like carbohydrate foods. So things like sugar or honey, adding those kind of ingredients to your meals can increase the calorie content of your food to help contribute to weight, either stabilization or restoration if you've lost some weight. In terms of with chemo?
Yeah, for chemotherapy, the as Judith kind of touched on, there are so many side effects from chemotherapy, and really through chemo, it's mostly about minimizing those symptoms as much as possible, because pretty much all of the symptoms do impact how you are able to eat. So obviously if you're feeling nauseous, you're not as likely to eat as much. Same with just general appetite being lower. If you're having any kind of bowel issues, whether that's constipation or diarrhea, that tends to affect people's intake as well. So we work quite closely with patients to minimize the impact those side effects have on their intake. So whether that's incorporating a high energy, high protein diet, liaising with doctors and things to chart medications that will help with diarrhea or nausea, to manage those as best as we can, so that from a food point of view, we're not impacting that as much. And
oh, sorry,
yeah,
go on.
sorry, go.
No, you go, finish.
And I guess from radiation, it's quite similar in terms of managing any side effects they might be getting, whether that's specific to bladder cancer or just in general of radiation anywhere in the body. We're trying to minimize those side effects. And I guess whether it's surgery, chemotherapy, radiation, all of those interventions make your body hypermetabolic. So your body is working so much harder to, one, I guess, fight the cancer itself, but also in terms of repairing from the surgery, which is quite a traumatic experience for your body, as well as chemotherapy and radiation. Those therapies don't just affect cancer cells, they affect your healthy cells as well, and your body has to repair from that. So your body's working quite hard on the inside, and we need nutrition to help support our body to be able to get better.
Yeah, I mean, because as we know, some patients that have had cystectomies it takes a while for their bowel function to return, because obviously we've used a segment of bowel. And, sometimes they may develop an ileus, where the bowel slows down. They may not have eaten for a week. So Amanda's asked, and she's seen this a lot, that a lot of the patients have lost weight after their cystectomy. What would you recommend for them to build back that weight again?
Yeah, so depending on with the ileus, so it's an ileus is pretty much a medical term that describes like a lack of movement somewhere in the intestines that leads to like a build-up or a potential blockage in any food material. So it can cause an intestinal obstruction as well. So depending on, I guess, how long the ileus sticks around, patients might not be able to have, for example, oral intake or even something called enteral feeding be put in place. So enteral feeding is nutrition that's being fed either through like a nasogastric tube, so a tube that's placed through one of your nostrils and goes straight into your stomach. And those patients who do have a intestinal obstruction might need to go on something called TPN. So it stands for total parenteral nutrition. And this sort of nutrition is pretty much intravenous nutrition. So a formula that has like your glucose, it has your fats, it has your proteins, pretty much get fed straight into the vein. So for patients who are expected to have an ileus for prolonged periods of time, may need to be put on TPN. If the ileus does resolve, I guess, spontaneously within a couple of days, then a patient might be encouraged to restart on an oral diet. So if they've had I guess, periods of weight loss, then again, we as a dietitian, we work very closely with our patients to implement that high energy, high protein diet. So starting off with small frequent meals. If that's not enough, we might recommend things like oral nutrition supplements. So drinks like Sustagen or Ensure, so they're high calorie, high protein fluids that are usually tolerated well. So I think patients tend to like to start off with liquids first and then slowly build up to like a soft diet and then back to their normal diet. So we can prescribe things like that. So aiming for that calorie protein to help with weight restoration, but also to meet those increased nutritional requirements after surgery as well.
And I think from an inpatient point of view, I guess if nurses are concerned about patients, I think a big part of our job as clinical inpatient hospital dietitians, we often are advocating for our patients in terms of speaking with the team about thinking about starting TPN or starting enteral feeds, because often we are the first ones to kind of suggest that and push that, because we can see this person's not meeting their requirements, they're unlikely to meet it for a few days, we need to be doing something. So getting a dietitian involved early is helpful, I think, and we definitely work on behalf of the patient in terms of advocating for their nutrition needs.
Two of our participants are thinking the same thing. Is there a link between sugar and cancer? Should cancer patients be on a sugar-free diet?
Yes, so very common. I think I get it daily at the hospital. In general, as a short answer, no. It's, I guess, quite complicated in terms of how our body works and how cancer works. But essentially, I guess the theory and the myth comes from cancer using sugar as its main fuel source. But we do also need to remember that your brain also uses sugar as its main fuel source, and your muscles. Our whole body likes to use sugar as its main fuel source. And cancer can actually use other fuel sources if it has to, but sugar is readily available within our body because almost everything we eat gets digested down into sugars. And I guess our main concern with such a restrictive diet is that it often leads to weight loss and quite excessive amounts of weight loss. And we do know that people who lose quite a bit of weight through treatment, whether that's chemotherapy, surgery, can affect how the treatment works, may cause delays in treatment, particularly with chemotherapy or radiation. We see that quite often. So it's important that we're fueling our body to get everything it needs. Now, that doesn't mean go and have all the sugar that you want and go overboard. Obviously, healthy eating is what we're aiming for. But often I have patients that turn up in the hospital who have been told to have sugar-free, gluten-free, tasty-free food, essentially. Some of them really get no enjoyment from their food, which is, I think, an aspect that a lot of people forget, that we don't just eat to fuel ourselves, we actually eat for enjoyment. Food is a big part of a lot of cultures. It's how we show love to one another quite often as well. So those aspects need to be taken into consideration as well. So not only starving, in your attempt to starve cancer, you're also starving your brain and your body and other things. So it's a fine balance.
I feel like, Judith, you're trying to say something.
I will. I guess my approach to sugar is slightly different. I think the answer is we don't know. And there are studies in mice at the moment looking at the impact of sugars in breast cancer patients, for example. And so the response is sort of the ketogenic diet for brain cancer possibly may have an impact. Different cancers are related to obesity as well. And so it's really individualizing. The most important thing is that somebody isn't malnourished. And if they can cut out refined sugars, which are really not really great for anybody, and replace these with an energy source that is equivalent, and that's where I think dietitians are really important, rather than saying, oh, that's a I don't agree with that diet, but if you say, but if that's the diet that you want to be going on to, the evidence isn't there yet. It may be there, that there's a relationship between refined sugars and some cancers. Why don't we just make sure that your diet is balanced, that you have adequate protein, adequate carbohydrates, adequate nutrients, and that you're not going into a cachectic state. Your body's not eating itself up to find energy. And I think that is where, and malnourished people don't have to be thin. So you can be malnourished and be quite large because you've got all the wrong foods in the wrong balance. And so I think rather than calling, I have this argument all the time with our dietitians. I say, until something is proven doesn't mean that it's a myth.
Yeah, and I think your point that having someone not being malnourished is the most important thing. And we do find quite often, I guess, with cancer, there's so much information out there, and you do really need a degree to be able to read half of it. Even then, again, you know, it's the way the media takes it is not always, I guess, displaying the most accurate conclusion of a study necessarily.
Yes. And it's healthy eating that improves, that maintains wellness.
Yeah, exactly. And I think, you know, food is often demonized quite frequently. At the moment, sugar is the big thing. Fat was previously demonized as making you fat. And I guess with all of us in terms of complementary medicine and, you know, using evidence-based evidence, essentially, it's important to be looking at the whole picture as well, and not just, yeah.
Sorry, so a bit off topic. Sorry, questions are coming through thick and fast. So I got to keep up. In terms of intravenous vitamin C and turmeric, Helen has asked, what would be the goals of these treatments?
So with vitamin C, it's got, I guess, the anti-inflammatory properties, and also with turmeric as well. So I'm guessing if someone's on IV vitamin C or IV turmeric, it's to fight off, I guess, inflammation. So yeah, that's the goal of that treatment, I guess. You have to know that with vitamin C, it is a water-soluble vitamin. So if your body is not particularly deficient in that vitamin, your body will naturally excrete it. So through your urine, really. So in terms of with, I guess, the guidelines, so from the World Cancer Research Fund and also the American Cancer Institute, they recommend that unless you're, I guess, deficient in any particular vitamins or minerals, that you shouldn't just rely on supplements to help, I guess, prevent or cure cancer. And I guess from a medical point of view, feel free to, Professor Judith, Lacey, feel free to jump in. But in terms of with, I guess, with things like IV vitamin C and turmeric, because of its very high anti-inflammatory properties, it can sometimes interact with certain chemo or radiation therapies as well. So that's also something that you need to be careful of. And if you do choose to go on those types of therapies, then making sure that you do disclose that to your oncology team to make sure that it doesn't interact with the medical therapy side of things.
Yeah. So vitamin C is very trendy at the moment. High dose IV vitamin C, oral vitamin C, liposomal vitamin C is commonly used. It may help also with people with recurrent UTIs, urinary tract infections in lower doses, but it's a potent antioxidant as well, and it may have, people are looking at its potential to support some people in their sense of well-being, particularly with during anti-cancer treatments and chronic fatigue. We don't know with vitamin C, so it's safety first. So if someone has a G6PD deficiency, you'd know it if you had it. Don't have vitamin C. And if you've got some renal impairment, you need to be very careful as well. Turmeric is commonly given orally rather than intravenously, and curcumin is a fascinating herb in Ayurvedic medicine in India. and Indian medicine. And if you look on PubMed, there's over 20,000 publications last time I looked and gave a talk on it, on the growing evidence as an anti-proliferative as well as an anti-inflammatory. It does interact with quite a few chemotherapeutic agents. So I recommend aboutherbs.com by Memorial Sloan Kettering, which is a really good free resource and an app you can get to check what the interactions are and the safety with your chemotherapy or your other treatments that you're having. It has an anticoagulation effect as well. So you need to be very careful if you're on a chemotherapeutic agent or something that can cause your platelets to drop, or something that can thin your blood, or that you're about to have surgery. Vitamin C shouldn't be used during radiotherapy because of its antioxidant effect.
And I think just to add to that,
yes.
I guess in terms of these with vitamin C and turmeric, that are obviously turmeric's got a lot of evidence, and vitamin C is at the moment a bit more popular and in fashion. With those components from food, we don't actually know whether it's that item on its own that actually has those properties. And like Judith has said previously, how food, well, you were talking about it with cannabis, but with food, how things are packaged together and what it comes with affects how it's absorbed. So we know with supplements and vitamins, when you take it in a tablet form, it's actually not as effective as eating a piece of fruit or, you know, a whole foods. Our body absorbs whole foods much better than oral supplements.
Yeah, and that's why Kirkman's commonly with pepper, or say have it with oily food or with oils, and similarly. Yeah.
Thank you. So just for those that might have just tuned in, you're at the Beat Bladder Cancer webinar Q&A session. Thanks for joining us. We are talking everything alternative. We're talking about wellness. We're talking about being healthy with cancer, surviving cancer. We're talking about exercise. Today's session, we're not focusing on the urology, the surgery, the sort of scientific stuff. We will at our next support group be having an oncologist talking to us. So I have noticed some of the questions about BCG and those sort of things. That isn't the focus of this talk. So we won't necessarily be answering those questions, but definitely all the questions around nutrition and diets and everything that we have had already. And here's another question, and something I've also often been asked before, about acidity and alkaline and pH balance in the body. Perhaps Judith, you could answer this one. Is there any evidence for having a high alkaline water, maybe pH of 9 to 10, in helping combat cancer? That sounds very high or low.
You know, Kalli, first of all, I think this is science, just to correct you. It is a scientific conversation. It's just not surgery or chemotherapy or radiotherapy. But I think most of the people here are scientists in some way. The answer is I don't know. And it is another one of those areas, and I'd be interested actually in the impact on recurrent urinary tract infections in changing the pH of the urine, if that makes any difference to recurrent infections. As far as does it treat the cancer, an alkaline diet, again, there isn't enough evidence to support it. And then the question is, can it cause harm? So there's all those filters you can get that alkalinize your water that you can pay a lot of money for. Some people buy carb in their water every morning. The question is, can it cause harm? Can it interfere with the other drugs or medications that you're taking and their absorption? Can it have a benefit symptomatically? And that would be a question for a urologist, perhaps, if changing the pH would give any symptomatic benefit. But I don't know the answer. Maybe someone else has.
More for managing infections, I guess the pH, managing the pH is important, but not in terms of, I don't think, combating cancer or curing it. Yeah. So I wanted to move on to our next speaker, Penny. She's from the Olivia Newton-John Centre in Melbourne, and so that's a dedicated centre, a wellness centre, much like the one that that Judith works at Chris O'Brien. So these are dedicated centers. I imagine like a one-stop shop where you can have access to a whole range of these alternative therapies in combination with your medical treatment at the same time. Is that correct?
Look, it is and it isn't. I think it's so I guess it's important to note that the Wellness Centre at the ONJ Centre is part of Austin Health. It's a public hospital in Victoria, in Melbourne. And the ONJ was very much built to bring all of cancer treatment together rather than splitting people from where they were having their chemotherapy and radiotherapy versus where they might come to an oncology ward and their specialist clinic appointments with their medical oncologists. And part of bringing that centre into one place was the development of the Wellness Centre itself. So I think where you've absolutely tapped into, this being a one-stop shop is very much around those complementary services that really support a person and their family and support network to improve their experience of both going through treatment and living with cancer. So we provide quite a number of services that have been touched on by some previous speakers. We have yoga, we have mindfulness, we have acupuncture, we have oncology massage, we have art therapy, we have music therapy, and I always forget things. We have exercise physiology, so we've set up an outpatient cancer exercise program that's for exercise to be delivered through someone's treatment that through COVID is now being delivered in the home, but we have our own gym that we've set up. And we also bring in external, we bring in some of the other things like look good, feel better, and some of the other elements that are really impact a person's life, wigs, all of those elements that affect how we feel and how we live through our cancer, I guess. And I think one of the key points is that we are not just our cancer and we are not just our carer identity. We are people, and a lot of these therapies and a lot of this work is to support people in both being themselves and sometimes really experiencing what they're experiencing and having a place for that to support them through a really incredibly difficult time in everyone's life who's going through cancer. It's not an easy time, and it's not an easy time at diagnosis. It doesn't end the day your treatment ends, regardless of curative versus non-curative outcomes. And, for some of us or for some people that challenge can actually add some quality of life as well. It can be an amazing time in your life to step back and consider. But a lot of the therapies are around supporting people through that experience. Psychology we have in our team as well, directly through the Wellness Centre. So I hope that answers your question a little bit.
Yes, it does. Yes, it does. Something that comes up quite a lot in our support groups and on forums is sort of this anxiety that goes around, and particularly in bladder cancer, because it's there's a lot of follow-up. It's very intensive. It can change. You can upstage. Suddenly there's surgery that's offered, and it's a major surgery with significant physiological changes in the body. Do you have any advice on people that are waiting for a result, or who are anxious, or have to make a decision?
Look, I think anxiety in cancer treatment and the cancer experience is really significant. So I think it's really important to acknowledge that a lot of the anxiety is completely normal, natural, and if you weren't anxious, then we would be more concerned than if you weren't. But obviously anxiety in itself isn't necessarily productive or a positive thing to experience at levels that are too high to be managed. So I think anxiety and stress and worry are a natural part of our response to uncertainty. But there are a lot of things that we can do to help manage that anxiety and to not necessarily keep it at bay, but allow it to come and go and not take over our lives. So there's many things that people can build in their toolbox to support them in that anxiety and that uncertainty. not all of them, and none of them, in fact, are silver bullets or magic wands. You know, they all require, I guess, work. They all require some time. They all require practice, but they can be incredibly powerful if practiced across time, and they can really then be utilised when needed. And I think the most important thing when considering trying things is, one, think about who you are as a person, what has worked for you in the past, what works for you. We've all had anxiety in our lives through, you know, going through school, going through life. So start thinking about what has been helpful to you in the past, what strategies are effective, how might you bring those strategies back, and really hone them, and then seek some more, try new things or build on the things that you already know really resonate with you, because everyone is different. It's quite an individual experience. For some people, meditation absolutely taps in. For others, they really need that experience of movement or talking therapy, or, you know, for some, they don't want to go there at all. For them, it's about really doing quite different things, you know, that you wouldn't necessarily call wellness work, but it is absolutely about wellness work. So really, it's about taking the opportunity, being kind to yourself, and not necessarily expecting something to work straight away, giving it a bit of time, being honest with yourself about what's working, and asking for help with if you think it's tipping out of control and you think it's tipping out of some of those methods, seeing your doctor and your nurse, and really sharing what the impact is on you. Are you sleeping? Are you not sleeping? What is your kind of self-talk going on? How are you perceiving almost your illness and its effect on your life and your relationships? And seek support and try different things. There are some amazing things out there. And this can be some of the silver lining, is an opportunity to go, hang on a minute, I've never tried art therapy, of course, you know, this hasn't come into my life. Is this something that might help?
So where, oh, sorry to interrupt you.
I think one of the other things that's really important is that you don't always need a professional. I think peer groups and sharing with people who've gone through something similar or are going through something similar, there's incredible power in that.
Yep. Our support group, yeah, we're very proud of it, and I think it's a nice little family, and everyone's very encouraging, and yeah, I think it's a great safe space for everyone to share their experience. Where's the best starting point for bladder cancer patients to learn about complementary therapies? How can they be sure that their GP or specialist knows about these places? Where can they get information?
Lovely question, and it probably depends where you are. You know, it does. If you're if you are going to a centre that has a bigger cancer treatment, then wellness centres are becoming way more prevalent. They're absolutely, you know, there's a number across Victoria, a number across New South Wales. Look them up. Feel free to cold call them. They will nearly always be, you know, manned. You can ring and you can ask as well. I mean, our GPs might be our navigators through our medical pathway in our normal medical care, but they're not necessarily going to know all of the offerings that could really support someone in living their best quality of life, either through cancer or post-cancer. So there's no one answer, but feel free to look things up, or even ring some of the main ones. You know, ring ONJ if you're in Victoria, ring Chris O'Brien if you're in New South Wales. People are very happy to almost support that, you know, that resource and that community.
Yeah, and they could, I suppose, advise where they are in other states as well.
And I think the Cancer Council has put together, the Cancer Council of New South Wales, and every state is a bit different, have put together a really nice booklet on complementary therapies, and different cancer groups have got, I don't know if it's the same for Victoria or Adelaide or elsewhere, but I think there are a lot of resources there. So I think that we're keen to be able to discuss it with you, but there's also limited resources to sometimes answer the phone. But the Cancer Council of New South Wales has really good online and booklets, some resources.
And are these wellness programs covered by Medicare?
So at the ONJ Centre, ours are covered by being a public hospital. So we don't charge for anything that we deliver. I think we charge $25 for our mindfulness 8-week course, but that's just for the for the recordings and things like that, the workbooks. But we work very hard to deliver our services free of charge. But it really depends on, I guess, where you're receiving the care. So in many ways, whether you're receiving it through a private wellness centre, if you're seeing, if you're going to yoga yourself rather than choosing a yoga session that might be targeted for an oncology patient. But if you go through your GP, then there are absolutely supports around cancer being a chronic disease and around community allied health. So exercise physiology, dietitian, all of those really key, not that other areas aren't evidence-based, but the things that are really natural referral pathways in the community are absolutely covered under Medicare schemes.
And so every system is slightly different, and we've just written a white paper and on integrative oncology and wellness centres, and to try and advocate for more to be on Medicare. If you see a doctor, then it's on Medicare. A lot of the private health funds will rebate, but treatments like acupuncture, yoga therapy is being taken off, as has reflexology, while massage is still on the rebate system, and exercise is on the system as well, but it's really a matter of advocacy as well. So a lot of the services rely on, the most important thing is equity of access, and still relying on philanthropy and a lot. And in Perth, for example, it's relying on volunteer practitioners to provide that service. There are groups like Dry July, so everyone should not drink in July, and donate your money to support your local wellness centre, and other great causes that make a big difference to the lives of people with cancer.
Judith, Paul was asking, can we access the white paper? Is it publicly available now?
Soon. We've just finished our latest draft, so we'll get there soon. Wow,
okay, so that's something to look out for. And Nanaka, just taking you quite a way back, you'd mentioned a website. I think it was in relation to herbs. Can you repeat that website again?
Yeah, so it's Memorial Sloan Kettering, which is a big hospital in New York. It's called aboutherbs.com. That's an app on your phone. It's beautiful because it gives a professional transcript with all the references that support everything that's been said, all the interactions, and also a consumer view in lay language. And that's really helpful.
Sounds really useful. Yeah, thank you. And I wanted to ask Penny one more question. When you go to your website, there's a lovely video by Olivia Newton-John. I was wondering if she's still very involved in the centre?
She's still very connected with the centre, yes. She's not in Australia at the moment, obviously. Whenever she comes to Australia, she visits the centre, and she's very engaged in the core philosophy of that equity of access that Judith mentioned. And her core philosophy was really around trying to provide to patients and to every cancer patient that came through the centre the same opportunities for complementary supports that had really helped her through her first experience of cancer and then her subsequent cancer experiences. So she's she doesn't manage us or anything like that, but she's absolutely very engaged and invested in us delivering the best care that we can.
Thank you. We had a comment. I'm sure we've got in the audience, we've got a wealth of experience. There was a comment probably related back to the anxiety comment, perhaps using something called a distress screen. Specialist nurses, Carla mentioned this, could possibly be a good starting point. I'm not familiar with this, sorry. But maybe you guys can tell us more.
So using patient-reported outcome measures is increasingly really important in the field of supportive care, integrative oncology and cancer care. And one of those screens, there's something called the distress thermometer, and there's something called the Edmonton Symptom Assessment Score that scores distress as well, where people self-rate their level of distress or their symptoms, and then we respond to those symptoms. And so that's what was being brought out. And there's a lot of work. I was just at the Clinical Oncology Society of Australia meeting. It was all about patient-reported outcome measures and how we should screen our patients. So we respond to the patient's voice rather than assume we know what's going on for them. And that's being rolled out right throughout Australia and around the world, actually, in cancer care.
Very interesting. So nice to hear what's current. Thank you. Thank you, Judith. Now, Andrew, we haven't forgotten about you, because exercise has been mentioned by every speaker till now. So clearly it's very important. So maybe you can tell us why it's important.
Well, thank you. And I have very much enjoyed listening to my colleagues. So exercise is important for a range of issues and a range of different times, I guess, in a cancer journey. So I guess the first thing to say is it'll provide physiological benefits. So exercise can make you fitter, it can make you stronger. It has emotional benefits. It can make you, I guess, relieve anxiety. It can ameliorate depression or a depressed mood. It can enable you, I guess, to more easily do the things that are important to you. Judith talked about using distress meters. I think one of the things that we use in physiotherapy and exercise prescription is we ask patients, well, what are the activities that are important for you to be able to do? And then you might titrate your exercise or get them to do exercise that'll get them back to doing those activities. So for the individual, I guess, at the point of presentation, great for physical well-being, great for emotional well-being. There are other benefits, I guess, sort of more holistic benefits of exercise. I think in some cancer diagnoses, exercise has been shown to be potentially have preventative benefits. And once you have a diagnosis of cancer, in some cancer diagnoses, there's links between exercise and, I guess, survivorship and longevity as well. So micro effects and macro effects. Professor Lacey said before, exercise is medicine. I think that's the sort of aphorism of the day. It's if you could stick it in a pill and promise the benefits to our patients and our population, everybody'd be taking it.
Yeah, that's true. So this is my pet favorite. What is the benefits of early mobilization after surgery?
Okay, yes, well, we're all moving, I think, to these enhanced recovery after surgery programs. A cystectomy, if that's what we're talking about specifically here, Dr.
Yes,
is a major operation. And with any major operation of the abdomen, there is the potential for, I guess, what we say, not necessarily complications, but you could say complications that would increase length of stay, potentially produce secondary harms. So getting up and moving early after surgery, it has benefits from a respiratory point of view. It's likely to reduce the risk of post-operative respiratory complication, chest infection. There is a well-established thought, I guess, that early mobility is likely to reduce the risk of post-operative clots, deep vein thrombosis. I think my dietitian colleagues might agree that early mobility and ambulation after surgery is probably likely to assist with gut motility.
I will agree with that one.
Yes, so yes, if I think in this day and age, if you have a cystectomy, you should probably go into it with the expectation that you'll be starting to get up and about and on your feet the next day for those reasons.
What would be a typical prescription that you'd send the patient home with? Is there such a thing, an exercise prescription?
Yes, I suppose, but it's generally not terribly complex. After you have a cystectomy, I guess there are certain things that you'd probably want to avoid doing for a period of time in terms of exercise. We probably wouldn't be prescribing sit-ups or very heavy resistance type exercise. Really, the best type of exercise to be doing early after surgery is walking, and a progressive graded walking program within comfort levels. How much I guess you would prescribe in terms of time for a particular patient would depend on their baseline level of fitness and activity, and I guess how they're recovering from their surgery. I would say to anyone recovering from any major surgery that best exercise for you to be doing in the early stages is getting on your feet and walking, and preferably walking with a friend or family member or someone who's going to encourage you to be up and about.
And do you recommend any, what should I say, forms of exercise we've mentioned in the group, such as yoga or Pilates or I don't know?
The best exercise is the exercise you're going to do. So if you hate walking, it's not the best exercise for you. If you enjoy doing yoga or Pilates, then that's probably a good starting point.
Right.
I think if you read a textbook on exercise for anyone, it's going to suggest you do a certain amount of cardiovascular exercise and you do a certain amount of what we would term resistance type exercise. And they'll give you times and intensities to do that over the course of the week. But if you're not going to do it because you hate it, it's the wrong exercise for you. I think the points that Professor Lacey and Penny made around getting people to do something that they're interested in, the yoga, the Pilates, whether or not it's funded by your health fund or your insurer, if that's the exercise you're going to do, find someone who can help you through it and who will do it with you, whether that's a family member, a carer, whether it's a group of people who are going through similar health issues as yourself. We found that works really well. Unfortunately, it's been stymied somewhat by COVID, but we are discovering quite novel ways of doing exercise in groups over Zoom, much the same way as we're discovering novel ways of delivering education via Zoom.
Yeah, had to change everything. He has a technical question for you at this hour. What might be going on the cellular level in terms of the benefits of regular exercise in fighting cancer? Claire and her partner, they're a regular member of our group, and often we're there with their canines. They say they like to get their heart rate up by doing some HIIT workouts. I'm assuming that's high intensity interval training.
Well, too tough for me. What's happening at a cellular level with cardiovascular exercise? Well, there's a range of things going on, but a lot of it's around peripheral capillary density. I might be getting a little technical there.
That's all right.
Better uptake of oxygen by the working muscles. With resistance training, it's really about building fibre diameter in your muscle fibres to build contractile force and strength. In terms of cellular effects to impact upon the cancer itself, the oncology itself, I'm probably not qualified enough to speak on that. That's probably something that requires a textbook or someone with a little bit more knowledge than myself.
Yeah, and Andrew, I think there's some really, I mean, it's interesting, isn't it? It's a really interesting space, the cellular level, and there's a group at University of Sydney who are working with us and probably elsewhere as well, looking at why it is that people who are exercising are actually living longer without cancer recurrence, and what's happening at the cellular level while exercising during chemotherapy, which is a pilot study that we've done and we're continuing to do. And is there something happening at the cellular level that is actually improving outcomes for these patients, as well as the impact on obesity and the impact of fat and body composition? That would be a really interesting space on, does it make a difference if people are actually changing their body composition and the impact on cancer and cancer outcomes?
My erstwhile colleague, urological colleague, David Galat, was working with a research group in the UK that was looking at inflammatory markers in prostate cancer and whether they were affected by exercise. And I think there's potentially some early positive results there. But again, this is probably fairly early in the research course around that.
I know there was some studies around exercise through radiotherapy, and that changed kind of the blood flow around the area and actually could improve the efficacy of the radiotherapy itself. But again, they were studies in mice, and as you say, very early evidence in some of those understandings of the positive impact of exercise. But certainly from an observation perspective, exercise doesn't just affect the physical space. Well-being, the engagement with others, it can be an incredibly powerful therapy. And
yep. No, it can. I was just going to add to that most of the studies in exercise like yoga and qigong have actually been done in breast cancer patients, because they seem to volunteer for more studies, and bladder cancer is less common than breast cancer, showing the benefit for cognitive impairment. So that cognitive fog that people often get with chemotherapy, particularly if there's a cisplatin or the AC and breast cancer chemotherapy, cisplatin in bladder and other cancer therapies. And also the improvement in peripheral neuropathy, which is the InFocus study that's still continuing now, which is common with certain chemotherapies, as well as the benefit for sleep in yoga and also qigong, and reducing inflammatory markers. So there's a lot of studies looking at the benefit of exercise. I think it's probably one of the most exciting areas in cancer medicine, I would say, at the moment, outside of therapy.
Absolutely. The one good thing about exercise and being able to study exercise is very easy in some ways to set a dose and to measure the effects of a dose. But the downside of that is the exercises that it's easiest to measure a dose of are walking on a treadmill and sitting on an exercise bike, which, if they're your thing, that's great. But for a lot of people, it's not their thing. And they might be interested, I guess, in more creative ways of exercising.
Sorry to sidetrack. Judith, you've mentioned Qigong. I don't know if I'm saying it right, at least twice now. And I'm very curious to know what it is.
So Qigong or Tai Chi are very similar. And it's that very slow movement working in traditional Chinese medicine to work through what's called the meridians, and it stretches most of your body, but it combines meditation, slow movement, and core work together in a very rhythmic way. So it actually works in quite a number of ways. So it's being studied quite a lot at Harvard. Harvard, they've got a very big study center in this exercise called Qigong or Tai Chi, and looking at the benefits. And yoga, which is based on Ayurvedic medicine or Indian traditional medicine, is being studied a lot on its benefit on psychological well-being through, and NICM, for example, the National Institute of Complementary Medicine, is doing studies in depression and exercise depression and yoga. And then coming back around, what's the relationship between that and the homeostasis and in the endocannabinoid system and, our whole immune system, and what's actually going on at that cellular level.
It all comes back to the cannabinoids. Back to Andrew. Sorry, we've had two questions from Amanda and Janet asking about pre-surgery exercise programs. So those going for cystectomy, is there benefit to doing exercise beforehand?
I'm going to say that you probably have not a great deal of lead time once a decision's been made to have surgery. So my advice would probably be similar to my dietetic colleagues, which is try and ameliorate your general health. Get up and about. It's probably not the time to embark on trying to become, your Arnold Schwarzenegger or your, what's the name of that cyclist, your Lance Armstrong. But important to be up and about, try and maintain a certain baseline level of fitness, do the other things that will help your health, like cease smoking, which will often bring good cardiovascular benefit off the bat. I'm not sure if you're asking or if the questioners are asking about things like pelvic floor muscle training in terms of a specific exercise regimen prior to surgery. I can make a comment or two on that. The other, I guess, exercise that you might consider in the lead up to a major operation like a cystectomy is if you did have pre-existing respiratory disease, there's probably some early evidence to suggest that some specific inspiratory muscle training might be of benefit to reduce the risk of post-operative respiratory infection. That evidence is probably, well, it wouldn't be around the cystectomy population just in and of itself, but you'd be talking sort of major thoracic abdominal surgery.
But I think if you do have time, there's a lot of work on increasingly more work on prehabilitation programs. So
Yes,
in,
yeah.
say, the pelvic exenteration group, there's quite a bit of work. People who are undergoing major surgeries and you do have a little bit of time, because if you go in a lot fitter, and not everybody gets cancer and is super fit and then just have cancer, they're often may have a bit of obesity, may have been smokers, you know, there's a lot of, but getting people as fit as possible before their surgery even, and that prehabilitation space is a really interesting space as well to be watching.
Yeah, I mean, there's no doubt there's some burgeoning evidence around that area. Even one of my colleagues, Anthony Bowden from Tasmania, published recently that just even 1 or 2 sessions of being taught appropriate mobility respiratory exercises prior to surgery will have benefit post-operatively. It's not really a huge burden in terms of the health system or for the individual, but of benefit.
Some of our patients will be going for neobladders. So instead of having a conduit with a stoma bag, they may have their pelvic floor muscles and their sphincter intact, and then the bowels connected to that. So they'll need control. So what about pelvic floor muscle exercises prior to surgery?
Yes. So probably not a great deal of evidence yet for this particular patient group. So what you're doing, I guess, is extrapolating from other patient groups, such as for men, and this is really my experience in working in this field, men who have had radical or going for radical prostatectomy, which suggests that if you are going to be doing pelvic floor muscle training, it will be a benefit post-operatively in terms of time to regaining urinary incontinence. But it works much better if you're going to learn it beforehand rather than after the event, when you're sore from the surgery and you've got a hell of a lot of other things going on. But I'm going to put a little caveat in there. You need to make sure that you're being taught the exercises appropriately, because there are also potential problems with activating the wrong muscles, and there are also potential problems with having hyperactivity, if you like, of the right muscles. So if you're going to do pelvic floor muscle training, it's probably reasonable, appropriate to seek out someone who's got fairly specialised niche knowledge in the area. You can, if you're looking to consult with a physiotherapist, speak to the Australian Physiotherapy Association, go to their website, look for someone who specialises in women's health and or men's health, pelvic floor physiotherapy. In fact, it's not even just about training the muscles. There's a benefit in learning things around bladder training and knowing about bladder volumes, and probably some benefit to be had from learning a little bit in advance about incontinence aids as well. But yes, see someone who's got specific training in the area.
A problem, as you know, with cystectomies is that patients may get parastomal hernias. Is there any exercises you can recommend to prevent that from happening?
No, I think I'll probably be talking out of school if I suggested that I could recommend anything in particular there. I'm not sure if Penny or Professor Lacey have any different experience to me in that area, but no.
No, but I think the hyperactive, the overstimulation of the pelvic floor actually in some of my bladder cancer patients has actually been problematic. You know, thinking they're doing the best, but actually getting into a difficult situation with chronic complex pain and difficulty. So I think getting the right pelvic floor exercises is just so important, isn't it? And being guided to learn how to do it properly. And I think that impacts also on sexual function, particularly in women.
Yeah, incredibly frustrating for the individual who feels like they're doing everything they possibly can do, and in fact it's being counterproductive.
Someone mentioned, or Helen Lacey asked about weight-bearing exercise for cancer patients during and after treatment. Is this recommended for all ages?
Yes, in short. Weight-bearing exercise is important. The only potential exception to that would I suppose be if someone had metastatic cancer and it was felt that there was a particular risk of doing high impact exercises in terms of potential for development of fractures. Again, there's probably burgeoning evidence to suggest that that concern is maybe a little bit overblown. And some of the reviews that are starting to be published now suggest that doing more than weight-bearing exercise, but really kind of resistance types exercises, potentially even osteoprotective, bone protective, interpret a little bit with caution at this stage. I think realistically, if someone's in a position where they've got metastatic cancer and is potentially at risk of fractures, they should be seeking specific individual medical advice about the appropriateness of particular exercises for them. But yes, no, weight-bearing exercise, great, do it. Everyone should be doing it. Everyone should be doing it from their teens, their youth, to build up that stock of bone.
And I think, Andrew, you said something really important. Sorry, I cut you off. That you need a personalised exercise program.
Oh, absolutely.
But from a specialist.
Yeah. And for those, I guess, who are not in the medical or health field who are on this webinar, you probably wouldn't go too far wrong if you sought advice from a registered physiotherapist and or an exercise physiologist who's an accredited exercise physiologist with Exercise and Sports Science Australia. And as with any field, there are going to be people who have more of a niche expertise in oncology versus other areas of practice.
We've spoken about a lot of physical things. Judith, maybe can you talk to mood, attitude, emotional states in recovery of a patient from cancer?
You know, I spoke a bit about something called the patient-reported outcome measures, and what they do is when somebody self-reports, and there's a recent study looking at self-reporting anxiety and depression, we know that it's, you know, people experience a lot of symptoms all at once, and anxiety, depression, clusters of symptoms, fatigue, poor sleep, feeling sad, feeling uncertain, and it's important to ask and identify it and be comfortable with the fact, I guess, that it would be very unusual if you went through a whole cancer treatment and cancer diagnosis without feeling sad or anxious or down about it, because it is a hell of a change to your life, to your future, to the way your family interacts, and it takes a while to deal with the diagnosis and then come to terms with the impact of the surgery or the treatment on your well-being, or the treatment or the chemotherapy or radiotherapy or whatever you're having. And so identifying that it's okay to feel different emotions and to seek help is incredibly important. So I would be saying, you know, all health professionals should really be asking, number one. Ideally, what things like patient-reported outcome measures means, they don't even have to ask you. You're sort of telling them just without even words, and they should be reflecting back to you. Sometimes the person that you're speaking to won't be your doctor. It may be the dietitian, it may be the exercise physiologist, it may be the massage therapist, the yoga instructor, but identifying. And what is beautiful about a lot of us, we all work in multidisciplinary teams, and it's all confidential, and we speak to each other to ensure that we direct you to the best treatment by the best people.
Thank you. Penny, it's not all about the patient. I mean, there's also the caregiver, and things can be tough for them as well. Are there any wellness programs for caregivers or support for caregivers?
Look, absolutely. And the simple answer is yes. And I think it's really key that cancer doesn't just happen to the person with cancer. It happens to everyone that they are around and associated with, and not always just the close carers either. This can really impact widely through the community. So there are absolutely carer groups, carer support groups. Carers also need to have, they need to understand, we need to understand that in cancer, carers are patients too. And those patient reported outcomes are often just as important in particular clusters around our carer experience. So while they won't have the symptoms of the cancer treatment and the nausea, they are often can have higher loads in areas like anxiety and depression at particular stages of the person that they are near treatment. So often during treatment, a caregiver will experience a higher emotional load than maybe a cancer patient, who will then often experience that post-treatment. So the experience of carers is really important to be acknowledged, and really important that we as caregivers also inquire into their needs and their current state. Yeah, yes. Look, I guess at ONJ, we certainly, a lot of our groups and a lot of our services are directed at both. There's quite a lot of things that we do where we do with carers and patients and together. Sometimes it's really important for carers to actually have a carers network themselves. And there are some things that it's very important for patients to be able to experience by themselves or with a group of other patients. So
yeah, that's what I wanted to ask. Are there carer support groups?
Yeah. Look, there absolutely are. And obviously it depends on your area. Again, Cancer Council of your state is a great way of finding out. Some carer support groups aren't cancer specific. They are carer support groups around caring for someone. And some support groups are cancer specific, but not tumour specific again. So really it's a matter of reaching out and identifying what's around. But Cancer Council is a great way of linking in.
And that's what's lovely about our support group. Most of our participants come with their significant other.
Yeah.
Which is great. It adds a nice dynamic, and yeah, and then the carers can reflect, say, what it's like, yeah, and they just egg each other on, and it's just great to see the support. I think it's so important.
Yeah. Yeah, none of us are in the world alone. We're in our relationships very much define us, and this kind of event, it's like, Judith was saying, this isn't a simple thing to just happen in your life. This is a really significant change, and those people around us are affected as well. And how we relate to each other absolutely influences how we go through this experience.
Back to the dietitians at Westmead. We had some questions from earlier we never had a chance to answer, and it just goes back to diet again. What's your thought on vegan diets in cancer?
I guess it depends whether someone's wanting to start a vegan diet because they have cancer. I guess that's generally something we wouldn't recommend. With vegan diets, you are limiting your protein sources that are available as an option for you to eat. And I guess those protein sources also tend to be less bioavailable. So you have to eat more of them to get the equivalent of, say, a piece of meat. And then you throw in the fact that your requirements are then higher, you have a huge amount that needs to be eaten. And if you're having any side effects, that can be a problem. If someone's already on a vegan diet, I think our main concern would be, are they able to continue that diet and maintain their weight and manage their symptoms that they get? If they're able to do that, then it's not really a concern. We would obviously be monitoring vitamins and things to make sure that, everything's sufficient. But to start a vegan diet because you have cancer, there's not really any strong evidence to suggest that. It's more that kind of general healthy eating advice, which is our Australian Guide to Healthy Eating is pretty much for prevention of cancer. And then we kind of adapt that based on if you're having symptoms through treatment and compensating to make sure that you're having enough for your higher requirements and adjusting that pace based on each person.
Well, I haven't heard of this one before, but what's a Mediterranean diet and how does that have an effect on cancer?
So in terms of the Mediterranean diet, it's pretty much a diet that reflects like the healthy eating diet pattern. So lots of like whole grain cereals, your fruits and vegetables, still having lean proteins, but in moderate amounts. And I guess reducing your intake of things like processed foods, processed sugars, and so, yeah, the Mediterranean diet has had a lot of evidence in regards to its like anti-inflammatory properties, but like similar to the Australian Guide to Healthy Eating, it's pretty much encouraging patients to choose those whole food groups and limiting like processed foods.
And there was that beautiful study from America showing the benefit for breast cancer patients on the Mediterranean diet and reduced recurrence rates, but I'm not sure about other cancer groups. And there are similarly some diet changes with red meat and preservative containing foods for colorectal cancer. So bladder cancer, I haven't seen much on actually bladder cancer and specific diets, but the Mediterranean diet's safe, it's healthy, and it tastes good.
Yeah. And I think from, I guess, a general Western Australian diet, we tend to eat a lot of red meat sources in our diet and pretty much beyond what is recommended. And that's kind of one of the shifts with the Mediterranean style diet. And even with our Australian Guide to Healthy Eating is just looking at more lentils, legumes, more plant-based proteins rather than just red meats. And I guess that's, the media and people often think quite black and white and extremes in terms of vegan diet. And that's not necessary to be healthy. You don't necessarily need to be vegetarian to be healthy, but including more plant-based proteins and reducing your red meat is one of the key things that you can do without necessarily going all the way down the other end of the spectrum and cutting it out completely.
And what about organic foods? I mean, we all see that section in the supermarket and then we look at the price and then we turn the other way. Well, I do anyway. I don't know, maybe other people do use organic food. Is it better? Is it going to help prevent cancer?
So there's very little evidence to show that organic food have, I guess, higher cancer fighting nutrients than your regular conventional food. Of course, there's, that price factor as well. So we're very lucky, especially here in Australia, that a lot of our produce is regulated by FSANZ, which is Food Standards Australia and New Zealand, which is a regulatory body that monitors like pesticide levels. I guess in conventional food where there may be use of pesticides, it's not in levels that are, detrimental to our health. There was a study done in France, I think a couple of years ago, that looked at patients who were eating organic foods versus conventional food and their cancer risk. They did find that patients who had more organic food had a lower risk, but it wasn't like a direct correlation. So they found that patients who ate more organic food generally led a more healthy lifestyle. So they ate, more fruits and vegetables, they did more exercise. So there wasn't a direct link between organic food and cancer. So like Dr. Kalli said, if, you prefer organic food, whether it's for you were brought up having organic food or you prefer, I guess, the taste of organic food, you can definitely go for that. But definitely regular conventional food has just as much nutrition as organic.
And I don't know if it's the nutrition, and I absolutely agree. I think it is the regulation and it's the pesticides, it's the hormones, it's the feed that certain animals may have had before they're served to you. And in Australia, we're fortunate with our regulation, but many countries in the world aren't. And so that's where getting organic produce, particularly stuff from overseas, where otherwise it's not as well controlled, can make a difference when it comes to pesticide levels and hormone levels in different produce and so on. And I think that is still a field that people are sort of working through.
What about agents that can cause cancer in our food? Like there was always a talk of artificial sweeteners, like, you know, I forget what it's called, but you know what, aspartame. And has there been any conclusive evidence that these things cause cancer, these foods, chemicals?
With the artificial sweeteners, I think they found that particularly in rat studies and mice studies, that it did increase I guess the risk of having bladder cancer, but in human studies there's quite inconclusive evidence. In terms of with artificial sweeteners, again, artificial sweeteners are significantly sweeter than your normal table sugar. So anywhere between 200 to 20,000 times sweeter than normal sugar. So in terms of the amounts that we're eating of artificial sweeteners, we don't eat them in to the level that it does become toxic or pose any kind of risk. Particularly with artificial sweeteners, it can be beneficial in some patient groups. So for example, patients who are overweight or obese, we know that with the evidence that if you're of a higher weight, it can increase your risk of cancer. So for example, if someone who was overweight and obese had, let's say, consumed a lot of soft drink, for example, switching over to like an artificially sweetened soft drink, like a diet soft drink or a no sugar one, can, I guess, significantly reduce their total caloric intake, which in turn can help them get down to that healthy weight range and reduce their overall cancer risk. On the other, in addition, so patients who have diabetes, for example, we know that with poorly controlled diabetes, so if a patient's blood sugar levels are consistently high, that can affect, for example, wound healing post-surgery, for example. So the use of artificial sweeteners for patients with diabetes who want to, you know, for example, have sugar in their tea or coffee, that's also another kind of indication where we could suggest artificial sweeteners.
Thank you. This is the Q&A Zoom webinar session for Beat Bladder Cancer Australia, and I'm going to be taking the last round of Q&A questions in the chat box. Any last physiotherapy related questions, anything related to the Olivia Newton-John Foundation and wellness centres, anything related to integrative oncology and dietitians and nutrition. There's a question for you, Judith Lacey. I think this would be for you, from Helen Lacey again. Oh, you're not related?
Not related in any way.
I was just wondering, I thought, did you phone up ahead and ask her to ask you questions? This question is asking, in women that have to have their bladder removed, their womb goes as well. So their uterus goes as well, part of the vagina. Some people opt to also have the ovaries taken out. So obviously this can throw you into early menopause. And unfortunately, we are seeing bladder cancer in younger women. So are there any natural therapies that can assist with the impacts of going into this early menopause state for hot flushes, altered emotional states, etc.?
It's really interesting, you know, in complementary therapies and integrative oncology centres, about 30% of our patients are breast cancer patients, or who will often be thrown into early menopause or have hormone treatment that causes hot flushes. And hot flushes, vaginal dryness, sleep disturbances, mood changes are all related to that early menopause stage. And the question is, first of all, what's safe to take? And what can be done for those symptoms. So number one is take nothing that's ingested as your ideal option. So looking at acupuncture for hot flushes. There's a recent study published in, I think it's either JAMA or JC or Journal of Clinical Oncology, one of the more significant peer-reviewed journals looking at acupuncture versus sham in menopausal hot flushes showing a benefit. And so it's always worthwhile seeing, is there something that we can do with a treatment like acupuncture based on traditional Chinese medicine to reduce hot flushes? There's also a recent study looking at the sleep disturbances and using acupuncture, and seeing, conducted at Memorial Sloan Kettering by the head of the service, Jun Mao, and colleagues, looking at the benefit of acupuncture versus cognitive behavioral therapy for sleep disturbances, showing that they are as effective as each other. Haven't shown in combination if you get double the effect, but sleep disturbances and hot flushes are often related as well. And then looking at the role of mindfulness in living with the changes of menopause that may be suitable for people. When you're talking about herbs and supplements that may benefit, it's the relationship. So in bladder cancer, if there's no negative with regard to estrogens, then you're looking at estrogen, the potential for estrogen therapy, or phytoestrogens like the soy-based phytoestrogen products, or black cohosh, and being careful of liver function monitoring during that, taking herbs such as those. And then looking at drugs like venlafaxine or duloxetine, which are actually antidepressants that may help with that really bad, I just can't live like this, hot flushes and sleep disturbances, just to get people moving forward for a period of time so they can get over that hump of being thrown into menopause and really not enjoying sleeping and walking around in singlets like people like I do in menopause, and searching for every glass object to lean against. And so it is important to look at what is the evidence, what are the options. And so this is really one of the main focuses actually of integrative oncology, is looking at what can we do that is non-drug that can improve those symptoms that are so common. Women, 50% of the population and those women who have cancer who are thrown into early menopause either through their chemotherapy or through their surgery or both, it's quite difficult, and it really impacts on and then on sexual function, but also self-esteem, well-being. And so then you're looking at topical treatments related to menopause for vaginal health and sexual function, being open about it. We have a sexual health clinic at Lifehouse run by one of our gynae oncologists. It's our pelvic floor physiotherapist works on sexual health. It's just really important to talk about it and say, come on, life has to be better than this. Early menopause is not pleasant, and it goes on for a while, and then you have to jump up and down because you've got bone health issues, and make sure your vitamin D level is high and adequate as well, and do your weight training.
That's pretty much all the speakers you just mentioned there. Yeah. Yeah. Well, I mean, I think we've sort of coming to the close of our Q&A session. The questions have slowed down. We've had a really nice compliment from one of our participants thanking us for all the contributions and what she can take away and share with her patients. Must be one of the nurses, so thank you. I would maybe just sort of close with each of you giving us a final word, something you'd like to say, a final thought. But it's truly been a great session. I've learned a lot. I think, Judith, the most important thing I've learned is we're all scientists. I won't forget that. And I think truly we can work as a team. And clearly there's a lot that we can learn from each other. And just need to be mindful of all the different components and aspects that go into treating a cancer patient. So yeah, let's have a final word. Judith, you want to put your final word in first?
Well, I will just say be comfortable in speaking to your treating team about what else can I do, looking outside of the box. And our toolbox is definitely expanding, and the evidence is getting there, and be open-minded and as health professionals, I think what I have learned over the years is to be open to get things wrong and to question and to say, wow, I didn't know that. That's really interesting. Let me look into that and see what else we can do.
Yep, we're a learner for life. Yep. Who is next? Andrew, yes, you probably want to go. Yes.
In some ways, echo Professor Lacey's words there and sort of maybe paraphrase a little bit, which is that a lack of evidence is not evidence of lack of benefit. And so a lot of the work that we're doing in this area, the research base for it is growing, but still in its sort of early nascent stages. And the things that we know today, for example, about exercise, we didn't know 10 years ago. And it is by people asking the questions and following through with the research studies that will really improve this space for our patients over the next 10 years.
Yeah, and I think it's the patients also taking interest in coming forward and wanting to be participants in the research, because we need them to be able to find out what all of this does. So that's important too.
And I also want to say what a pleasure to hear from all of my colleagues in the room. So thank you for inviting me to be a part of this. I've learnt a lot too, a lot more about cannabis than I knew before.
Yes. And Alana and Celeste, what would you like to say?
I think I'd like to say we get quite caught up in the nitty gritty and, you know, is this food good? Is this food bad? But we forget about the big picture. And for nutrition, it is big picture. Doing those health lifestyle, general healthy eating, it sounds really boring and really repetitive, but that's where it's at. And, you know, having a piece of cake now and then is not ruining everything. It's not going to make your cancer worse or anything like that. It's about those everyday patterns and lifestyles changes that you make that make the biggest difference overall. So don't get caught up in the nitty gritty necessarily.
And I think we're talking a lot about wellness and like overall health as well. Just remember that, you know, this experience is, you know, different for everyone, and you're just to be kind to yourself as well. So particularly from a food perspective, like Alana mentioned earlier, you know, food is not just, you know, to give your self nutrition, but also we tie a lot of our emotional connections to food as well. So, you know, yeah, be kind to yourself.
Thank you. And certainly last but not least, Penny from the Olivia Newton-John Centre, what would you like to say?
Well, I'm now very upset that I didn't go second last because Alana, you stole my line. I think be kind to yourself is actually incredibly key. Don't get caught up in thinking there's a rule book and you need to get it right. While there's absolutely evidence around population health and some of the benefits of things, everyone is an individual. Cancer doesn't discriminate. We can't say that we got cancer because we did something wrong. Start taking the judgment away and start doing your own patient-reported outcome measures and think to yourself, what is kind to myself today? Today, it might, you know, what is kind to myself both in the moment and what might be kind to myself across my future planning and my building of my toolbox. So in the moment, you might choose to, you know, give yourself a gentle treat in food, but still across your week be increasing your plant-based food. And you might be, you know, so it's that taking away the judgment in the kindness and trying to have kindness in a really almost intelligent and considered way, so that you become part of your own care. I think that's what, I've got to share.
Thank you. Very inspirational words of wisdom. We had 2 more compliments from Grace Mary, who's a cancer care nurse in Blacktown Hospital. Thank you for a great session. We had Carla, who said, thank you to all the speakers and your passionate insights and ongoing research. We thank you. Thank you to all the participants, mostly for joining us this evening and coming to hear what our prestigious guest speakers had to say. We plan to do this twice a year. This is our second one for the year, and we will continue next year. We run a support group every month, and we have a guest speaker from all different aspects of cancer and survivorship. And that's a national Zoom webinar support group. And we've also got a website, which you've all seen, hopefully, and that's got a whole range of resources. All our speakers of tonight will be doing a YouTube video, which will be going up on the website as well. So look out for that, as well as this recorded live session. Please feel free to reach out at any time. We have an email address. We have a social media presence. Yeah, we're available, and we have access to all our speakers at any time to ask them questions, and we can come back and give you the answer. So thank you once again. And I don't know if Christine or Adam want to say a final word.
Just very quickly, because you know, we're running over it, and we've covered a huge amount of ground. So I mean, let's say I've learned an awful lot as well. It's been a wonderful discussion. I took away simply that the importance of an integrated wellness approach, both from an emotional well-being and a physical well-being perspective, but in a balanced way, in a way that you enjoy. And as Kalli has said, there's the information you can access via the website, and also Cancer Council was referred to a number of times for some really good resources, and indeed the referrals that each of the panelists have provided along the way. So a lot of content for people to go away with, but you know, contact us if you would like, or contact some of the referrals that were provided on the day, just to help you on your bladder cancer journey, either if you're a patient or a carer, and to help if you're a nurse or an allied health professional to help in those discussions that you're having with patients and carers and families. So wonderful webinar. Thank you so much to all of the panelists. Thank you.
Yep, and we just wanted to say, look out for beats. We're finding ourselves on banners across the city, in malls, in toilets. So we're definitely expanding our presence and getting the word and creating awareness of bladder cancer. So yeah, please support us.
And thank you so much for the invitation, Christine, Kalli, and Adam. I think it's absolutely wonderful that this exists, and it's been an honour being involved.
Thank you. See you all soon.
Thank you so
Bye,
much.
everyone.